welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. All right. Let's get started. We've got a lot of juicy information for you today on Body in Balance. I want to say thank you to all of my listeners. I see that I have 3,700 subscribers. I need you to like, click, and subscribe. Share all you want to. There's some great information out here and more to come. I have 70,000 people that have watched, and it's just been for the last 3 months, but I intend to keep giving you great information to protect you and your body and to keep it in balance. So we're going to talk today about blood pressure medications. Now, I want to give a plug here. I have practiced Western medicine for over 22 years. And that's what I know, Western medicine. There are holistic people out there that know more about herbs and trees and grasses and different fruits and things that will help you to lower your blood pressure. I'm not saying that's not out there, but I work in what I'm working in. I do what studies I know, and I follow the studies that cover Western medicine. So for those of you that have been prescribed medications, I want you to understand what you're on, understand how it works in your body, understand what your doctor needs to do to help you while you're on those medications. I'm not telling you not to follow holistic medicine. You do you. But right now, I'm trying to help those who are on medications be protected and know the right answers for what's going on. So now that I have said that, I will probably look into getting a holistic person on to kind of give some other perspectives of Eastern medicine and different, more natural things outside of what I have learned and practiced. Okay. Now, that being said, let's get down to the agenda. We want to talk about normal versus abnormal blood pressures. We want to talk about common blood pressure medications, the 4 common blood pressure medications that you may have in your medicine cabinet. Targeted organs. We want to talk about what do those blood pressure medicines target. And we want to talk about side effects. Yes, we definitely want to talk about side effects because this is what it's all about. This show is all about, and that's to get you a better understanding so you know what's happening with your body. Then we're going to talk about coming to, I'll give a summary of the conclusion. Now, that being said, we're going to talk about these different normals, abnormals, and medications. Okay, so here we go. For elevated blood pressures, that would be between 150 and 190. That's for your systolic number. Your diastolic number is the bottom number. That would be over 100. If you have prehypertension, that's 130 over 40. Now, usually that was considered normal. And some people still are calling that normal, but aggressively, we want to take care of these blood pressures, because if you're hanging out around 130, then you'll get to 140 real easy. And so we want to make you aware. So 130 over 40 is considered prehypertensive, with 140, 132, 140, and over 90. So 90 is the diastolic. Ideally, where we want you to be is 110 over 110 to 120 over 70 to 80. Over 70 to 80. Now, considered low blood pressures in that blue area is 70 to 90 over 40 to 60. That's too low. So if your blood pressure is that low, and if you're a very, very thin framed person, like say you don't weigh more than 120, then to have a blood pressure at 90 over 60 or 70, that's not too bad. But if you are, say you're 170 and you've got a blood pressure at 90 over 60, that's too low. So maybe your blood pressure medicine is too high. That would cause you to feel like some of the older people in the church would say, I got swimming about the head, meaning they're feeling dizzy or lightheaded. That once you check the blood pressure, if the blood pressure is 90 over 60 or 50, then that's too low. They need to change their blood pressure medicine. Maybe they don't even need blood pressure medicine. Okay. Now, when you look at on the right side of this slide, if you're looking at a computer and you see the right side of the slide, there's the heart there. And you'll see how these vessels on the outside, you remember in one other, I think it was 2 episodes before, we talked about heart disease. And so all the blood in your body does go through the heart. It has to be pumped through the heart because it has to be pumped into the lungs to get oxygen and come back, and then it gets pumped out. So every bit of blood has to go through your heart. That's not what sustains you. It is these vessels that you see on the outside of the heart, which sustains the heart to keep you from having a MI or myocardial infarction. Now that I've talked about the vessels on the outside and the inside of the heart, because the heart is a big muscle, we're going to talk about how the blood flows through the heart. So we're going to get ready to talk about how the blood flows through the heart. That's my segue to my video.
Or atrium, and the lower chambers, which are thick-walled pumping chambers called ventricles. Red blood cell will come from either the superior vena cava or the inferior vena cava and enter into the right atrium. Blood then flows across the tricuspid valve to the right ventricle. The right ventricle then squeezes and ejects that blood cell into a vessel called the pulmonary artery. Pulmonary artery splits into 2 vessels, each going to the lungs. As that red blood cell makes its way through the lung, it returns through the pulmonary veins to the left atrium. That blood is now oxygenated. It's picked up oxygen, then goes across the mitral valve into the left ventricle, which does most of.
I want to slow this video down to show you something. You have the blue side, that's the unoxygenated blood. You have the red side, which is the oxygenated blood. But between those vessels, you see gray. That's the muscle. When that muscle becomes thick, when it becomes very thick, then the volume of blood that can be held is smaller. So when you have a smaller volume, at that point, where's that other blood going to? That's how you get it to back up either into the lungs, because if it's the left side of your heart that's getting thick, it goes back into the lungs. If it's the right side of your heart that's getting too thick, then it goes back into the legs. So you'll see the swelling of people with really thick ankles and thick lower legs. If you were to take your thumb and to push against, or finger and push against there, it would leave an indentation. That's called pitting edema. Pitting edema. We'll talk about that at another episode, because that would be talking about congestive heart failure.
The work in terms of delivery of blood flow to the body. That blood cell is now ejected into the aorta to some organ or muscle or skin in the human body.
All right. So we talked about high blood pressure. When it comes into the right side, that's when the heart is filling. When it starts coming in to the body, that's when the heart is filling. When it gets pumped out, that's when it's pushing it out, because it's done what work it needs inside the heart. So filling is the diastolic number. That's the lower number. That's when your heart is resting. Pumping out is when it's forcefully shoving that blood out to get to the rest of your body. So let's talk about these medications. Common blood pressure medications are ACE inhibitors or ARBs. ACE inhibitors are angiotensin converting enzyme inhibitors. These medications help to relax the blood vessels by blocking a particular chemical. It's a natural chemical that's in the body already, and it tends to constrict or narrow your blood vessels. So this medication blocks that and dilates it or opens it up. So where it was constricted, this medicine opens it. That would be lisinopril or enalapril. That's Vasotec or Prenavil or Zestril. Those are medications you may have in your medicine cabinet, and they are common. They are very helpful for the kidney. ARBs. These are angiotensin 2 receptor blockers. So these block the action of the same chemical that narrows the blood. But what it does, instead of affecting the actual chemical, the receptors that takes that chemical, they tend to block that. Some examples of that medication are Cozar or Valsartan or Diovan. In the blue, look at the bottom at the blue, you'll see where it talks about water pills. This is known as a water pill or diuretic. Diuretics help the blood get rid of excess sodium and the water. That's the thing that helps to control whether you swell or don't. Common diuretics are hydrochlorothiazide. That's a mild diuretic, a very mild diuretic. So it's not going to get rid of fluid as quickly as another one, what we're getting ready to talk about, Lasix or furosemide. Lasix or furosemide. If you have shortness of breath when you're walking and it feels like your heart is fluttering, all those things are occurring, then Lasix and your ankles and feet are swollen really badly, or your abdomen distends, then they'll put you on furosemide to get rid of all that fluid quickly. They don't do that with hydrochlorothiazide, as it just doesn't work as quickly. Spironolactone, that's another diuretic. It works in a different part of the kidney. You guys are not going to be medical doctors, so I'm not trying to do that for you. We don't need to talk about the different parts of the kidney, but we do need to talk about spironolactone is going to be used more in a person that is pregnant because she can't take the other two medicines, but spironolactone is not going to affect the baby. All right, beta blockers. Beta blockers are great medicines to help when we're talking about heart pumping, the slowing down the pump of the heart, that forcefulness of the heart. These medications reduce the workload of your heart, and they tend to open up the vessels. They dilate the vessels to open them, causing your heart to slow down, so it can do the beat. That way, you don't have this hard, forceful pumping because it's pumping against constricted vessels. So there's less force. Metoprolol, atenolol. These medications are beta blockers. Calcium channel blockers. Now there's a few calcium channel blockers, but we're going to talk about them all together as one family. Calcium channel blockers, these also help to relax the muscle of the blood vessel, the smooth muscle of blood vessels. So it's not so much like the muscles in your legs, but the smooth muscle of the vessels. Also slows the heart rate down. So examples of this is amlodipine or diltiazem. Those two different types of calcium channel blockers, so they work two different ways. All right, let's talk about target organs. So what do these blood pressure medicines affect? That's a great question. Glad you asked me. The kidney. ACE inhibitors and ARBs, along with diuretics, affect the kidney. So ACE and ARBs work together. Now, you don't take both of them together. You either take one or the other. But both of these medications, they're kind of cousins. So they control the constriction. Remember I told you about the tightness and being more dilated? So they control that, whether it's constricted or not. If it's constricted, it makes the heart have to work a lot harder to squeeze that blood through there. So these also, both medications protect your kidney very well. Diabetics will, most times, you may not even have high blood pressure, but they're going to want you to get on it. They're not doing it because they're trying to hurt you or they want you to take another medicine. They're doing it because they want to protect your kidney. So you're usually on a lower dose, like 5 milligrams. I don't think they do 2.5 anymore, but it's about 5 milligrams that they'll use to start out with. Now, on African Americans, those medicines tend to not work as effectively unless they're at higher doses. So your low dose may be a 10 milligram tablet. Diuretics, they reduce fluid by getting rid of potassium and sodium. So if you're losing a lot of potassium, I don't usually give my patients that are going to be on a diuretic. If you work in a construction area or something like that, and you're going to be outside and it's hot and you're sweating a lot, I try not to give you a diuretic because of the other side effects with it. And if you don't keep up with drinking fluids and getting potassium in, it could be a problem. The next organ is your heart and the vascular system. So we're looking at the vascular system and the heart together, but the vascular system is its own entity. Beta and calcium channel blockers. Beta blockers slow the heart rate down, decrease the force so you're not working so hard, dilates vessels, and controls the adrenaline in the vascular system. Calcium channel blockers tends to dilate the vessels also and causes smooth muscle relaxation. All righty. The side effects. This is important. Get your notepads out. ACE inhibitors are notorious for causing a cough. Well, why is that, Miss Johnson? Oh, I'm so glad you asked me. That's a wonderful question. ACE inhibitors are angiotensin. Remember, I said angiotensin converting inhibitors, enzyme inhibitors. Well, that particular enzyme is also in the lung. So because it's in the lung, it just doesn't really understand to just go after angiotensin inhibitor in the kidney. It can sometimes affect the lung. And if the lung seems like it's getting restricted, then God put the cough mechanism in for us to be able to force air through the lung or force whatever is causing our lung to be blocked to open up. So be aware that sometimes if you've been started on an ACE inhibitor within a few weeks, maybe a couple of months, you may start having a cough. If that's the case, talk to your doctor about that. They may have to switch you to an ARB, which is less likely to cause that problem. Diuretics, I just talked about diuretics. They cause you to urinate more. So if you urinate more, you're getting rid of potassium and sodium. Now, my suggestion is if you are on a diuretic, don't take it at night. You're going to be up, running back and forth to the bathroom, and you're going to get little sleep. So I wouldn't do that. I would take it during the daytime. These medications also help with edema and swelling, which is great. They will tend to get rid of sodium and potassium. They also watch out for your protect your kidney, but they can be damaging to the kidney if you don't have the kidneys checked because you're not drinking enough water, you're not drinking enough Gatorade, you're not eating enough bananas, you're not eating enough kale or mustard greens or collard greens. You're not having enough potassium. The other thing that these tend to do, if you don't keep up with the potassium in your body, you'll get cramps. Let's quickly get to the beta blocker and calcium channel blocker side effects. Beta blockers, they slow the heart rate down. So if you are planning on working out, say your doctor gets on you about your weight and wants you to work out, but they notice that your blood pressure is extremely high, I don't think they're going to give you a beta blocker if you're in your 40s, 50s, now 60s, and you want to work out. They're not going to do it. Could happen, but if they do, you want to ask if they could do something different because it slows the heart rate down so that it's hard to work out. It'll lock you in to a particular rate. Now, B on this slide. Men, if you weren't paying attention, and I want to say based on my analytics, I have 60% more men watching, so you better pay attention to 3B. These medications tend to affect your erectile dysfunction and can cause erectile dysfunction. You may want to ask your doctor about considering a different blood pressure medication if you're younger. So if you are in your 40s, 50s, 60s, and you're still very sexually active, you want to make sure that you're not on a beta blocker. It can cause some problems. It is more likely to than some of the other blood pressure medications. Now, however, if you've had a heart attack, there's not much you can do to protect you from having another heart attack. They have to use the beta blocker until your heart heals up. So you can go without it if you want to, but you still won't have any, you still won't be able to do anything because you don't have, because now you're risking forcing your heart to work too hard. So I want to reiterate to you that you want to watch what you're doing with those beta blockers. Now, let me say this about a beta blocker. Yes, they do help with the heart. They are the number one medication for if you've had a heart attack. But if you need to have a beta blocker and you're in a younger age range and still sexually active, you may want to consider Bistolic. Bistolic. You'll want to consider Bistolic because Bistolic tends to not cause as many problems as some of the other beta blockers like metoprolol or atenolol. Also, those that have asthma. If you have asthma, most doctors know better than to give you a beta blocker with asthma. So if they do, you want to use labetalol. Labetalol you can give to a person that has asthma. Most pregnant women, they use labetalol as a beta blocker for that. Calcium channel blockers, there's several types, I think 3 different types, and they work differently. But what you want to do is you'll talk to your doctor about it. Just be careful about having a beta blocker and a calcium channel blocker together because they slow the heart rate down so much. You'll feel dizzy, lightheaded if you're taking both of those together. So most times they're not going to do that because they don't want you to have that side effect. But just in case it happens, it's something to bring up with your doctor. Amlodipine is also known, it's a calcium channel blocker for causing edema or swelling in your lower legs. So, in conclusion, make sure you understand your normal parameters for blood pressure. 130/70 is pre-hypertension. It's still a decent blood pressure, but you're getting up there. You want to kind of watch that. Watch your salt intake. The 3 organs that are affected are your kidneys, your heart, and your vascular system. Your kidneys, your heart, and your vascular system. Make sure you work with your doctor about getting quarterly to at least biannually a creatinine and a BUN or blood urea nitrogen. Those check for the functionality of your kidney. You also want to check your sodium and potassium. If you're getting a whole lot of cramping and you're on a diuretic, you definitely want to talk to your doctor about getting that checked, okay? Diuretics cause you to urinate a lot. Beta blockers slow your heart rate down. Men, libido. Beta blockers. ACE inhibitors can cause a cough. Calcium channel blockers may cause swelling. And beta blockers, we talked about, can hinder your exercise progress. So we have talked about a lot of great information. And at this point, I hope that you have gotten a lot out of this and that it will help you to thrive. Hopefully, your horizons have been enlightening.